Experts in the health sector have warned that the Social Health Insurance Act of 2023 is set to disadvantage women and reverse gains made in ensuring equitable access to reproductive health services if the plan to reform Kenya's health financing is not refined. Here is our health and science reporter, Gloria Milimu, with more.
This law is coming to take away from the Constitution.
The Social Health Insurance Act of 2023 has yet again come under sharp criticism. Health experts now warn the government's strategy to reform the country's health financing is one set to renege on the provisions of Article 43, Section 1A of the Constitution that guarantees each Kenyan citizen the right to access the highest attainable standard of health, including reproductive health care. They say the act falls short in specifying the fate of Linda Mama program, a scheme under the former National Health Insurance Fund, NHIF, that seeks to ensure that expectant mothers and infants have access to quality and affordable health services.
Though it was a great thing that happened to women, the issue still of access and gaps that it had, that after delivery then, you need certain support which you could not provide, which you could not find. With this one being silent, I think we are getting back to a very gray area where we are not even sure what is now going to be provided.
Dr. Christine Sadia, the chairperson of Kenya Medical Women Association, has also poked holes in the scope of care offered by the newly commissioned 100,000 community health promoters in relation to maternal health. She argues that their training is not adequate and as a result can impact on the health outcomes of mother and child.
If you're being told that somebody's checking you, they have a gadget, they can check your BP, everything is fine, the nitty-gritty of looking at the lie and other things that the urine would provide, and a gynecologist or somebody who is more trained will pick so that your risk is mitigated before you actually go into labor. Some of the things that we are finding that will be missing out, if already is not, the package is not going to be refined.
Health experts have also criticized the new health financing model, saying that it is skewed towards the rich. According to Section 26, Part 5 of the Act, allows both tiers of government to deny services to any person who fails to show proof of compliance in registration and contribution. They argue that gender attributes like poverty, lack of education, among others, which disproportionately affect women and girls, will increase the access to health gap as opposed to bridging it.
The biggest burden that has been, even before, when services were even free for women and children of under 5 years of age, we were finding that women were not accessing care, not because they didn't know that services existed, not because they didn't know that it was beneficial to them, but the barriers to care are around issues to do with out of pocket.
What parameters will be used to determine who is supposed to pay 300? What parameters are going to be used to determine who is vulnerable member of the society?
In what now seems to be a rallying call to protect healthcare access in the country, the experts say a review of the model by the courts is necessary to ensure realization of the right under Article 43, Section 1A of the Constitution. Gloria Milimu, KTN News.
Wrap for KTN News.